Okay, looks like we have a couple more joining, but it's slowing down a bit. So welcome. You are here for the EHR Downtime webinar, a when, not an if. The presentation will begin in just a moment. All of the attendees are in listen-only mode. So if you have any questions, there is a questions window box in the menu. Feel free to submit those questions during the presentation. We will answer those as best we can. Also, you will receive a follow-up with a recording of the webinar. It usually comes out about a day or so after we've done the webinar. All right, we can go ahead and get moving, Vic. All right, EHR downtime, a when, not an if. All right, again, there's that question window. If you guys have any inquiries or questions during the presentation, don't hesitate to send those over. We will answer those, and hopefully we might have time at the end to follow up with some as well. All right, let me give you a little info about eMedApps. About us, eMedApps is a healthcare information technology services company providing practices, clinics, and hospitals with a full range of services as well as a suite of products designed to increase efficiency and facilitate communication. We were founded in 1999. We've worked with a partner with NextGen since 2001. We've worked as a subcontractor for NextGen. We serve healthcare clients across the USA, and we have services and products for NextGen clients as well as other EHRs. All right, and feel free to go out and follow us on all the social media platforms, Facebook, Instagram, Twitter, and LinkedIn. Subscribe to our YouTube channel. We do have many of our demos on that channel as well. So just look for eMedApps on any of those platforms and go ahead and give us a follow. All right, let me give you some info about our presenter today. Vic is our VP of Product Development. He's been with the company since its founding, and he brings experience and deep knowledge of the healthcare community's toughest challenges to consistently deliver excellence, innovation, and success to clients. Great wealth of knowledge. He's also a Chicago Bear fan, still. So let me pass that over to Vic, and he'll be doing the presentation today.
Thanks, Holly. Yeah, still a Bears fan. So let's get started here today. Outline of what we'll be talking about today. I kind of thought it would make sense to break this up into three different sections. In the first section, we'll talk about what to do before the downtime event occurs, planning, implementation of procedures and technology, testing of those procedures and technology. Then we'll talk a little bit about what to do during the downtime. How do I communicate information out to the team? What is the data access that's going to be required by my different members in my organization? How am I going to handle documentation and billing to continue seeing patients when this downtime event occurs? And then finally, we'll wrap it up with the post-downtime. What do I do after it's done? How do I roll back to using the EHR, back to my normal workflow with regards to my patient visits? And what do I do with this data that was generated during that downtime event? How do I get that information back into my EHR? We'll talk a little bit about that as well. If there are any questions that come up during the talk, please feel free to put them in the window. We'll try to address them as we go along in the areas they're pertinent to. And then we'll also have some time at the very end to come back and answer some questions as well. Okay, so let's get started. Planning for the downtime. As we said in the title of the slide, a downtime event is a when, not an if. It is going to happen, and you need to spend some time putting together plans to make sure you're able to address this issue when it occurs. So in order to do that, the first thing to do is to look at what are my downtime events that my organization could experience, and then plan accordingly based on those events. So we break these out into two very large buckets: our planned downtimes, which are events where I as an organization am in control. I know they're going to happen ahead of time. They're happen for a variety of reasons, but I'm aware that they're going to happen, and I can make sure my staff is informed ahead of time and we can have the appropriate procedures in place so that we can deal with the situation as they occur. The two main sources of these planned downtimes, the first are hardware updates, whether that's for systems that are hosted by yourself in your data center, or if you're using a third-party hosting vendor to host those products, and they need to go through some hardware updates. It is going to happen. It is part of having a viable system to keep it updated, to keep things functioning properly. So here, the key factor to realize is you're in control of that schedule. Schedule these hardware events to minimize the patient impact. So overnight, weekends, times when I'm not going to have patient impact, I want to focus on getting these hardware updates done and making sure my system is available, updated, and ready to go. From the software perspective, we often run into clients who don't do software updates. They don't want to deal with the downtime. They don't want to deal with having to bring the system down, so they let their system go unupdated for a while, and that's a recipe for disaster. You don't want downtime to be a reason not to keep your EHR updated. Your vendors are providing software updates for very good reasons. There are a lot of informational updates that'll be beneficial to your team from a workflow perspective, from an operational efficiency perspective, but there are also updates that often are security related that are important to keep your system as secure as possible and as up to date as possible. So really, downtime shouldn't be a consideration when deciding whether or not to upgrade your system. If your plan is robust enough, you can accommodate downtimes, even if they go into days during an upgrade. It's not uncommon for an EHR upgrade to take a couple of days from start to finish. By the time you begin the update process, go through the update, and then validate the update afterwards. So that has to be factored in as well before you allow your staff and your providers to be able to access the system and start using the EHR again to capture patient visits. On the unplanned side, a plethora of reasons why you might have a downtime of your EHR, depending on whether your systems are hosted at your organization or if they're hosted elsewhere. There are a number of things that could come into play that could cause you to be unable to access the EHR system. So the first thing that you need to do as part of this downtime planning is to determine what are the most likely sources and locations for these failures, and what are the most likely locations to be affected. You may find that your primary concern for a downtime may be site specific. You may have a satellite location that has questionable internet connectivity, and that may be your primary source of concern. It may be something that spans the entire organization. It could be a data center concern. It could be concerns over hardware that's available in the data center. Whatever those issues might be, identifying those issues allows you to tailor your plan accordingly to try to address the most likely causes of problems. So you want to make sure that plan fits the issues that you're having. That way, you're investing your dollars where you're most likely to see an impact. Right? You don't want to solve a problem that you're never going to experience. So if you do a good job in this phase in trying to determine what are those most likely causes of failure, then you can design your downtime plan accordingly so that you're able to address those issues. You can't have a solution for every possible scenario. I suppose I shouldn't say you can't have a solution. It's cost prohibitive to have a solution to address every possible scenario. So you want to make sure that you're leveraging your resources to address those most likely issues that you're going to be running into.
I have a couple questions for you, Vic. So
Sure.
one question is, how do you schedule a planned downtime if your system is hosted by someone else?
Yeah, great question. So you certainly should have input with your hosting vendor in terms of when maintenance events are going to occur from a hardware perspective, and you definitely will drive the discussion from a software perspective, right? So you're going to determine your schedule for upgrades. Sometimes there are things that are out of your control. So it is often based on the availability of your EHR vendor to assist with that upgrade. And in which case then you aren't in full flexibility in terms of when that upgrade is going to occur, but you certainly have a voice and a say in the process, and make sure you exercise that voice. Determine when it makes sense for your hosting vendor to schedule your hardware updates or downtimes for server maintenance. They have to bring the servers down, reboot them, whatever the operation that they need to perform is. That schedule works with your team and works with your off-hour processes as well.
Okay, and one other for you. Is having a hot site a good downtime plan?
So a hot site is really in the area of disaster recovery, and that's a good question, because it kind of I probably should have mentioned this earlier in differentiating between your disaster recovery and your downtime planning. So your downtime planning is really business continuity, right? What am I going to do to continue business operations while my system is unavailable? Disaster recovery is, how do I get my systems available again so that my operations can resume to normal workflows? They work hand in hand. The more robust your downtime plan is in place, it allows you some flexibility on your disaster recovery plan to give you time to be able to bring systems back online, so you don't have to invest as much into those disaster recovery plans. Hot sites are great disaster recovery solutions, so that if there is an issue with your primary location, whether that again be at your clinic or at a data center, you're able to quickly switch over to a secondary system that allows you to get back and running with your normal workflow. They are expensive, so depending on how quick that changeover is, adds to the cost of the disaster solution. So with a robust downtime plan, you can give yourself time to switch over to that disaster solution if appropriate, for software updates, for hardware updates, for internet outages. You're really not going to switch to your disaster solution, more than likely, again, depending on what that solution is. But for a natural disaster that causes your servers to go offline, a fire, something like that, where your servers are going to be offline for an extended period of time, then switching to that DR system makes a lot of sense, and the business continuity plan allows you to bridge that gap. So you're able to keep operations running while you're making that switch to your DR solution, and it buys you time in that process. So having a robust downtime plan can really help you on the cost of your disaster recovery solution as well, and often pays for the entire downtime process.
Great, thank you. Continue.
So in the planning phase, some of the areas that that you need to think about is communication. How are you going to make staff aware that there is an outage and that the downtime workflow needs to be followed? What is that communication protocol? Sometimes your most common outages will affect your communication mechanisms as well. So you want to make sure when you're planning your downtime based on your most likely scenarios, that your communication protocol follows suit, that I'm able to actually communicate with my team based on the method that I've put together. The rest of your plan needs to center around your visit workflow. How am I going to handle patients that come into the clinic when there is an outage? Who are the different teams that need to be part of this downtime solution, and what are their processes going to be? So from the beginning to the end of that patient experience, starting with the check-in, how are my patients going to check in the event of a downtime? What are the things that my staff need to have available to them in order to service those patients? Do they need to be able to look up patient balances? Do they need to be able to collect co-pays and patient payments? Do I need to set up ancillary processes for that in the event of an outage? From the triage perspective next, what data are my clinical assistants going to be looking at? Are they reviewing patient histories? They're collecting vitals. What am I going to do with that vitals information? On the visit itself, my clinical staff are going to be reviewing patient histories. Do they need access to the previous visit notes so that they can have that information available to them? How are they going to chart this new visit? What kind of protocol am I going to follow for them to be able to capture data from that visit? And then once the patient is done with the visit, how am I going to deal with them on checkout? Do I need to be able to capture follow-up appointments? What is my process for doing that? How am I going to give the patient that information so that they have that follow-up appointment available to them? So kind of factor your or create your disaster recovery plan from a workflow perspective, right? What are the different touch points that this patient is going to have with my staff, and how are they going to supplement the information they need that they're not going to be able to get from my EHR and PM system since it's unavailable? Once I've got that plan set up, how do I implement the plan? What are the steps that are going to be involved in making that plan a reality? So the first step that you need to do is to document the processes that'll be used by each role. So once you've identified what your check-in staff is going to do, what your clinical staff is going to do, what your checkout folks are going to do, document that process so that it's available for everyone. The downtime procedure is not something your staff is following often. And so you certainly don't want there to be a learning curve when there is a downtime in order to implement that process. You want it to be available to them so that they're able to access that information. Deploy any new technology that you require as part of this downtime. So you've identified the information that your team is going to need in the event of a downtime. So deploy whatever technology makes sense to achieve that, so you're able to get to that data and have that information available. Test your downtime process. This is critically important. You don't want the first time your team is experiencing a downtime process to be when there is a downtime, right? You want to be able to test that process as part of your implementation, and you want to do that ongoing as well. You want to train your staff, so that make sure that your staff is aware of what those roles, what their roles are going to be in the downtime. What am I going to be doing? What are the steps that I need to do to achieve each of my job functions? And then the last item here I kind of already hit upon, but ensure that that policy is available. In the event of a downtime, your staff hasn't really run through this since either the last testing process or the last downtime. So you want to make sure that they have the processes and procedures available to them. Does that mean you need to have paper copies available because your online file share may not be available in an outage? Then that may be the solution that you need to entertain there. Testing your downtime process. You want to make sure you test all of the processes that are involved. The best way to do this is a mock downtime. Right? Take your staff, section of your staff, and put them through a mock downtime. Don't let them use the EHR system. Go through a mock of your downtime processes. Make sure that you're able to see patients. They're able to go through the different procedures that are in place, and they're able to execute them the way that they're supposed to be executed. You may find that you have to modify your downtime process based on this mock downtime. You know, everything is great in theory, and then when you try to put it into application, you find holes in the process. You find things that you hadn't thought about or weren't incorporated in the plan that need to come in here. So this becomes sort of an iterative step here, where you're doing your testing, you're finding issues, you're modifying the process, and then you may have to do another test to test the procedures as they go through. This doesn't have to be your entire staff that's going through this this mock go live, but it needs to be all of the different roles that are going to be partaking in the downtime, or a subset of those folks that are going to be partaking. You need to periodically test your downtime systems. You don't want to find out there's an issue with the downtime system when you have an actual EHR downtime. So make that part of your normal IT workflow to do periodic testing of these downtime systems to make sure that they're available, that they have the data that's necessary for your team based on your plan that you put together.
I have a question, Vic. How often should they test it?
That's a good question. We certainly would recommend testing systems at least on a quarterly basis, so that you know that your systems are available and they're functional. For your downtime entire process itself, that's certainly not something that you need to do on a quarterly basis. An annual basis is usually sufficient to make sure that those processes are good and functioning properly. But that may change based on changes in your environment. So you introduce a new system or a new process into your practice that may require changing the downtime procedure based on that. Well, then you need to go through that process of putting together the plan based on that new workflow, that new system that's brought into place, and then go through a testing of that plan when that occurs. All right, so now we've planned for the downtime. We've implemented the systems that we've determined that we need to implement for that downtime. We've gone through the training with our team, but prior to that training, we've gone through the testing. We've iterated through the workflow. We've trained the team on our final workflow. We're back to our normal EHR operations, and then a downtime event occurs. What do I need to do? So step one here is communication. Right? We need to make sure that we inform all the staff that the EHR is unavailable and that I'm initiating the downtime procedures. If your downtime process requires a change in patient workflow, then you need to make sure you're informing patients as well. Patients that are on the schedule for that day, that they're aware that there may be a change to their workflow in terms of their check-in process or what they might be doing. And again, this depends on the plan that you put in place for your downtime. Your downtime systems need to be made available. Depending on the downtime systems, these may be things that need to be turned on or made available by your team, or they may be there available all the time. Whatever is the appropriate situation for that downtime system, it needs to be brought online. If it's a read-only system, then your team needs to start accessing that environment. You need to make sure you communicate with the team the plan for restoration of services, so that when that initial event occurs, if you don't have a ETA yet, then make sure that everyone's aware of that fact. And then as that ETA comes into view, that you communicate that information out, so staff is aware of when the systems are expected to be online again. Dealing with data access during the downtime. So once the users have switched to that downtime process for data, they need to be able to access the data that's important to them. What is the information that I need to be able to safely see this patient and conduct a patient visit with that patient? Things like medications, order history, labs, vitals, previous visit notes. What are the items that I've identified in my planning that I need to make available to these patients, and make sure that to my clinical staff, and make sure that data is available through my downtime system. It should be readily accessible. Again, this isn't a system that your staff is going to be going into on a daily basis. So you want this system to be available, accessible, and you want them to be able to find the data that that they need to have. They shouldn't have to be looking for that information. It shouldn't be impeding in their clinical visit. The information should be available to them so that they can complete their clinical visit as they would have using the EHR. Really important to have the necessary information so that clinicians can make informed decisions on their patient's care. Documentation and billing. So in the event of a downtime, I am seeing patients. I want to be able to document that patient visit. You need to be able to capture the events that occurred with the patient so that your EHR can be updated with that information when the system is restored. So you have continuity of care, you have a complete record of that patient. You will need to use some sort of a form, some sort of documentation to be able to capture that information. That could be electronic, it could be on paper, depending on what your downtime process and tools look like. Certainly using forms can assist in this process to help guide that note capture. So if you have forms for your common visit types that your patients might be having with the practice, then your clinical teams can use these forms to guide that note capture. You must have a process in place to keep those notes secure. If it's paper forms, how am I keeping these forms secure? What is my policy for those forms being retained by either the providers, by the clinical staff? What is the life cycle of that form to make sure that those documents aren't misplaced or lost? This is certainly easier to accomplish if you're taking these notes electronically. If you have an electronic system that you're using for being able to guide that note capture, the security aspect is certainly easier to accomplish that way. Do I need to be able to share these downtime notes to help with patient care? Do my on-call team need to have access to what happened during that patient's visit that day in the event the outage continues through and the patient calls back? How am I going to accomplish that? What is my workflow for this documentation to make sure that it's available to those that need to have access to it? And then on the billing side, this really looks at the financial impact of a downtime, right? So if I'm able to capture charge codes during the downtime, I can certainly minimize the financial impact of that downtime if I'm not trying to chase those charges days or even weeks later after the events occurred. I can certainly assist in keeping my my accounts receivable days low by those charges going through the normal process once connectivity is restored and my EHR is back online. And my back office team is able to go in and generate claims and send those charges out and make sure that we get paid for them. So this needs to be part of your decision making process as well. How am I going to handle charges? How am I going to document those charges during the visit? And then how are those charges going to get back into the system after the EHR is available again? Okay, so I've managed the downtime. I've put my processes into place. I've captured the necessary documentation that I needed to based on my visit types for the appropriate forms for those visit types, or in generic sense the documentation that I would need. And now my EHR is back online. My issue has been resolved. The system is available. What are the steps and procedures that I need to put in place now? So now that the EHR is back, the first thing that you need to do is, again, communication. We need to notify everybody that the EHR is up and available. So whatever communication mechanism you had in place to inform of the downtime, you should leverage the same communication mechanism to inform everyone that the EHR is available again, and you can start logging in, you can start accessing information. How do I get people back on the EHR? It makes a lot of sense to sequence the roles that are coming back online. And a great way to do that is based on the patient workflow. Start with your registration and scheduling team. Those are the people the patients interact with first. So your check-in process goes back to the EHR workflow when the EHR is available. Bring your clinical teams online next. So I'm able to chart that visit, and I'm able to capture information on that patient back into the EHR. And then finally, your back office and financial teams to come online once the EHR and the PM are back and available again. The reason you want to think about doing this is you want to minimize data loss concerns by bringing the entire role online at the same time. So you don't have cases where the nurse is doing the intake using the EHR, but your provider is still using the downtime system and is unable to see that intake information that was done by the nurse, right? So you want to make sure that entire role is accessing either the downtime system or my EHR and not sort of splitting duty between the two. Now, location-wise, certainly it could make sense to bring the clinical staff by location online with the EHR as opposed to bringing all of them up at one time if it makes sense based on the type of outage that occurred and the downtime that occurred. Updating my data back in the EHR. This is a step that no one likes to do. Once your EHR is back online, you're seeing patients that are on the schedule again, and now I've got this documentation that's sitting that needs to be done. So you want to make this as painless for your team as possible when the EHR is back online again. The first thing you want to do is to document the documentation that was captured during the downtime. You want to make sure that that's brought into the EHR. So if they're scanned, if they're paper forms, you want to make sure those get scanned in to the EHR. So they're available for your team to use. Multiple team members can access that form, and this really facilitates putting the data that needs to be in the EHR back in there. If they're electronic forms to begin with, those could be brought back in automatically. So they're available when EHR is brought back online. Those can be pushed in depending on the process that's involved, and that information is available and in the system for you. What do I need to chart back into the EHR? You need to bring in any of the discrete data elements that make sense for the organization. Things like appointments, orders, vitals, medications falls under orders. Really any of the data that you need for your quality reporting, right? That quality reporting is going to be based on discrete information. It's not going to be able to be run from the scanned in note or the electronic note that came in. So you want to make sure that you're capturing all of the discrete data that's required for your quality reporting into the EHR so that when those reports are run, that information is available and is part of that reporting. The charges that were captured during the downtime, if those charges were electronic, they can be pushed back into your PM system so that your back office team can go through their normal workflow, create those claims, get them out of the door so you can start to get payment on that. Have some sort of a mechanism to check to make sure that data has been brought in for those visits that were seen on the downtime. If there's some custom reports that you need to generate from your EHR in order to be able to make sure that all those visits are accounted for, that you have some oversight procedure in place to make sure that that data is getting back into your EHR. Again, it's important for your quality reporting, so you want to make sure that you have visibility into that, so that if you're checking to make sure that orders have been brought in for those visits or whatever the appropriate data elements are for your organization, that you have some sort of a post downtime process in place to check that data has been updated and that data is available in the system. So to recap, I
have a couple other questions real quick on the
sure.
Updating. Okay, so if you're using paper for your downtime, do we need to keep the paper documents as part of the chart?
That depends on how robust you're putting data back into the EHR. So if you're recreating that entire visit in the EHR and generating a visit document from within the EHR, then you certainly don't need to keep that paper document. However, as most organizations do, if you're doing a limited entry into the EHR, then that paper chart document really is the visit note, and it does need to be in your EHR system. Bringing that into your EHR after the downtime is really helpful to facilitate the data capture into the system. It's really hard for your clinical staff, your providers, to be sharing that piece of paper in order to be able to enter that information into the EHR. But if you scan it into the EHR it's available in there, then different folks can access it, can do what they need to do with the data that's on there, and capture the information that's necessary to them in there. So although it's certainly not required if you have the appropriate documentation to support the visit without it, it certainly can facilitate your process to have that as part of your downtime solution.
All right, thank you. One other for you. When updating the EHR after a downtime, how do you reflect the correct day or time that the visit actually happened?
It is EHR specific. All EHRs will have a mechanism for you to be able to do this. If you're doing it based on the scheduled appointment and kind of going through a check-in process like you normally would, then this should pretty much be automatic in your EHR system. As you're charting that information, it's going to be tied to a visit based on that appointment. So it's going to have the appropriate date and time associated with it. If your reconciliation process does not call on you to check in, not your reconciliation, sorry, your downtime process doesn't require you to check in those appointments, create visits from there, then you need to make sure you create visits with the appropriate date and time when you're going through that process. So that needs to be part of your plan as well.
That's all. Thank you.
Okay, so let's just recap real quick on what we talked about here. The first is start your process now. If you're not already doing a downtime process or you haven't started planning your downtime process, start as soon as possible. Downtime is a when, not an if. It's going to happen. It's probably already happened. You may not have had a process in place to deal with it, but getting a process in place, getting the tools in place to deal with it, certainly now is the best time to go there. Implement those tools that you've identified as part of your downtime process. Make sure that you have the information that's necessary for your team with those tools and get them configured and set up so they're available, and then periodically test them to make sure that they're there. Test the plan. Make changes to the plan whenever necessary. As I said, if we're incorporating new procedures, new systems, there are changes to the environment that are going to require me to change my my downtime processes. Make sure those changes happen as soon as possible so that you're able to test them, you're able to put them in place, and they're available if there is a downtime. Make sure that plan is available. Don't rely on communication through mechanisms that may be affected by your downtime. So when you identify those most likely causes of downtime, make sure you're looking at them from a communication perspective as well. If I'm relying on internal email, is that internal email going to be available in a situation that's causing my EHR not to be available? Or do I have a secondary mechanism to get to that email if EHR is not available? So what is that best communication protocol? And then make sure that that plan's available, whether it be doing it on paper for there. Periodically test the tools that are being used, as we talked about a little earlier with response to one of those questions. Make sure you're doing this at least quarterly so that you have confidence that those tools are available and the data is available for your team. Depending on that tool, you may want to do it more frequently if you have concerns about the availability of that tool. Make sure your plan addresses getting the data back into the EHR once it's available again. You don't want your quality reporting to suffer because you had a downtime. So you want to make sure that you're getting the appropriate data back into the EHR so that you can deal with, so that when you run those quality reports down the road, your data is robust and complete. So for some of these organizations that you may be having other data reporting requirements that you have to worry about, like UDS and things like that, then this becomes even more important that you're charting these visits in your EHR so that when your UDS report process, for example, can pick up all that data from those visits that occurred during the downtime. Okay, I've got a couple of resources here, and we're gonna send you copies of these slides so that you'll have these available. SAFER is a safety insurance set up by the Office of the National Coordinator, dealing with multiple different issues that an organization might face. One of those issues is contingency planning, which downtime falls under that heading of contingency planning. So this document kind of talks you through doing a more formal contingency plan and checklists that you might want to generate as part of that contingency planning to be able to go through and plan accordingly for these downtimes. The other recommendation, or the other reference here, is from AHIMA for downtime planning in medical practices. I thought it was a really good resource that kind of walks you through the downtime process and things you might want to do and consider, and creating that plan, and basically doing different plans for different types of downtimes that you might occur, for planned versus unplanned downtimes, and changes that you might want to have in the plan for dealing with those scenarios. So another good resource for you to be able to get information on that. With that, I'll open up for any questions that we didn't get to during the discussion.
All right, I have a few more in here, not too many. You probably, the whole presentation addressed this, but I'll ask the direct question. How do you recommend teams evaluate and continuously improve their downtime and recovery procedures?
Yeah, we kind of talked about this a little bit during the discussion, but testing of the procedure, critically important. Make sure that you test, and you test every role that's affected by the procedure. Do testing on an ongoing basis. If there are changes, make sure those changes are reflected in the plan, and that new plan is tested again, and then rolled out and trained accordingly. So it is an iterative process. It is something that you're going to have to keep looking at. And last but not least are the results from the downtime itself. So you may find that when a downtime occurs, certain things didn't happen the way you expected them to when it's used on a large scale, and that's going to generate some process improvements in your downtime as well. And make sure those are captured and the process is refined to deal with the information that came from the downtime.
Alrighty, and another question, what commonly goes wrong or surprises teams while they're planning or implementing their downtime procedures?
I would say the biggest concern that we run into, or the biggest roadblock, maybe a better word, that we run into when we're dealing with organizations and putting this in, is when you present this to your clinical team, the lens that you present this in needs to be what is required in the event of a downtime to continue providing quality patient care when you have a complete lack of information. And what I mean by that is, what is the bare minimum that you need to provide quality care to the patient, with the alternative being having nothing available. What we often get into is a mindset of the clinical staff of comparing the downtime process to the EMR, right? And to say that, okay, I have this, and this available in my EHR. Why is that not available in my downtime process, right? Your downtime process is not an EHR. You're not recreating the EHR. You're not recreating all of the features and functionality that exist in your EHR in your downtime process. And making sure that your team kind of looks at the process from that lens, that you're basically building on nothing as opposed to subtracting from the EHR, right? So you want to start with, I have nothing available, my systems are offline. Now, what are the things that I need to add to that so that I can create a system where I can provide proper patient care? And what we find is when we take that approach with the folks, it is a lot better in terms of the data sets that they would like, because if you leave it completely up to the clinical teams, they want the EHR, right? They don't want the EHR to be offline. They don't want there to be a downtime. They want their entire EHR available to them. And that's not a reality in a downtime scenario. That may be a reality as part of your hot site or your disaster recovery plan, as we talked about. But the downtime is really focused on bridging the gap till I'm able to get back to that spot where I have that EHR completely available to me. And so make sure that your discussions are from that perspective.
Awesome. Thank you. And the all-important question, what do you think about the Bears' new GM?
I will refrain from those comments.
All righty. Well, thank you everybody for joining. We do have about 10 minutes left. If anybody would like to stay on, we do have a downtime solution that Vic could show a few screens from. If not, no worries at all. If there's any other questions, again, you will get a follow-up email with the recording and the slides. And if you know who your rep is, feel free to reach out to them directly for any other information, or you can send an email to info@emedapps.com. So again, thank you today. Anybody that would like to stay on, if you want to just do a brief screenshots for a few, Vic, we would love to see our example of, it's called CareFinity Downtime.
Sure, yeah, I can pull that up and kind of walk through it real quick.
Awesome.
So our CareFinity solution is a...
I do have another football question. What do you think about the Packers loss?
I am smiling.
There you go. Okay, go ahead.
Okay, so hopefully everyone can see that. CareFinity is a web-based solution. So again, as you kind of determine what the issues are that you're trying to resolve with your downtime, this can be architected to fit accordingly, whether it's on your intranet, available via the internet, whatever makes sense based on your downtime scenarios. I'm going to go ahead and log in here. We do support multi-factor authentication, and I've got that set up here. So if you are opening this to the web, you can certainly add a level of security by using multi-factor and having a code sent to the user. CareFinity is a multiple practice concept. So if you have different data sources that are creating data, maybe different EHRs within your organization, and you need to keep that data within CareFinity, you can create different silos of data from within there. And so I'm just going to go ahead and log in here. And when I do that, in the event of an outage, it takes me right into my appointment listing for the day. I have the ability to look at different provider schedules, different dates based on what my need might be. And then I'm just going to quickly open up a patient here to give you an idea of what the data looks like on that patient. So this takes me to what we call our patient dashboard, which is summary clinical information about that patient. At the top of the page, you'll get patient demographic information. If you're capturing the patient EHR, and depending on your EHR system, you could get that patient picture as well in here. And then you get some summary clinical data, their problems, allergies, meds, visit, lab, and order history. So what we show you is the 5 most recent items available in those sections. So the most recent data is going to be available for you there. And you're able to then go in and look at that information. You have a chart that opens on the left-hand side here that allows you to go through different sections of that patient's CareFinity record, so the different data elements that are available for that patient. So I'm just going to run through a few of these here. So for example, if I want to pull up my medication history, I can do that and look at the patient's medication history. I'll see all of the different medications that have been prescribed to that patient over time in this practice. I'll see the start date of the med, the medication and dose, the quantity and refills, the stop date, and the prescribing provider. I'm going to jump into labs here. If I wanted to review laboratory data for that patient, I could do that. I have all of the different lab panels this patient has had. So if I pull up this CMP, for example, I can see their CMP results over time. I'll see all the different dates they've had CMP done, and then I'll see the most recent data here. We do color code the results as you would expect, and you have the ability to trend your lab data as well. So if I wanted to look at that patient's glucose over time, for example, I could do that and see, kind of, are there any alarming trends that are occurring with this data? You also have access to your visit notes. So if I wanted to look at a previous visit note, I could do that by going into documents. We give this to you in two different flavors. One is based on the note type, and the other is based on a chronological view. So you'll see the most recent notes for that patient available to you here. Let me open up a test patient, another test patient where I actually have their notes so you can see what that looks like. So I'm able to search my patient book. Yeah.
Real quick, how do you see this data if the system is down? Where is this coming from?
Yeah, depending on your downtime setup, this may be running on your intranet. So let's say your EHR is hosted externally, and your concern or your primary area of concern is being able to connect to that external EHR. Then this could run on your local intranet within your organization, so people are accessing it internally. If your data center is local and your concern is the availability of that data center, then you could host this externally, and your patients can access, your users can access it over the internet.
And then one other question.
Be a combination of the both.
So this is basically a backup version of the EHR that gets carried over each evening.
It actually, depending on your EHR system, it can sync more frequently than that. It can be every 30 minutes to an hour. Where data gets updated in CareFinity, depending on how you configure it and how you set it up.
Great, thank you.
So I'm going to come in here to view this visit note. My visit notes are going to be available to me from within the environment here. So here's that visit note for me that I can view. So all of my visit notes, all of my image data is available to me by default. You certainly could configure your deployment of CareFinity to limit the amount of data that's available there for you. And then finally, the last thing I wanted to show you here is your ability to capture information back. That note that we were talking about, you can capture a note in the system. We offer two different flavors to do that. One is a free text note where I can just type in, if I'm using a system that has voice recognition, I could dictate in there. And the other is to use forms that you can design. So for example, if I want to create a telephone call, I can choose my telephone call template, and then I'm going to be given a form to fill out based on what my practice set up. So you can define these forms based on your common visit types so that you're guiding that note capture from your users. And with CareFinity, when connectivity is restored again, this data is pushed back into your EHR and made available there. Same thing with charges. You have the ability to create charges from within here. So if I wanted to capture those visit charges from within CareFinity, I could do that. I could capture those charges. And again, when connectivity is restored, those charges can be pushed back into your EHR and made available there. So that's a quick overview of CareFinity.
Great, thank you so much, Vic. And again, everybody, thank you for attending today. If you need some further downtime assistance, feel free to reach out. If you have any questions about the demo and the presentation specifically, feel free to let us know. And also, if you want more information about our downtime solution, we're happy to get that for you as well. So, and follow us on our social media platforms. We'd love to hear from you guys in other areas as well. Everybody, thank you for attending and have a great afternoon.
Thanks, everyone. Take care.